We begin tonight with a 17 News follow-up. One day after Kern's public health director expressed deepening concerns about skilled nursing facilities here in Kern County, he's now calling on the state to do more. 17's Eitan Wallace joins us with Matt Constantine's message for state regulators.
Yeah, Constantine says this issue is critical, noting we're not just talking about numbers, we're talking about human lives.
And we need to do everything we can to bring about change.
Speaking via Zoom today, Constantine said more must be done to protect patients and staff at Kern area state-regulated skilled nursing facilities tasked with caring for our community's most vulnerable.
Our worry is that this is going to quickly develop into something that we can't contain.
Appearing before the Board of Supervisors Tuesday, Constantine expressed a number of concerns about these facilities, noting they account for roughly half of the county's COVID-related deaths. Today, he said some of the facilities are uncooperative.
Surprisingly, there have been a few facilities that not only have been resistant to our help, have not allowed us to enter, not allowed us at county cost to provide early identification of positive workers.
And to this day, he said Valley Convalescent Hospital and Kingston Healthcare Center have not done enough to curb outbreaks at the facilities. What's more,
they're admitting patients while there is an outbreak occurring. That is not appropriate.
Skilled nursing facilities are solely and completely regulated by the state, but Constantine says the state has not done its part, forcing the county to get involved.
The state, recognizing that there were outbreaks and that they needed to take action, sent a letter to all of our skilled nursing facilities requiring them to develop a plan to test. And they gave them 3 weeks to develop a plan, not 3 weeks to test, 3 weeks to just put a plan together that said they might test in the future. We felt that that was completely inadequate, so we immediately hired a team of nurses. They go out early in the mornings and start testing.
But he says that has been a challenge given that some of the facilities have not been communicative. Now, he's calling on the state to do more.
We feel the state hasn't taken action quick enough and strong enough to protect our community. We want the state to be here. We want them to assess what we've seen. We want them to mandate testing. We want them to limit admittance to a facility that is having an uncontrolled outbreak. We want the state to mandate that they have stabilized their staffing. These are fundamental minimum requirements that we should ask of anybody that's caring for the most vulnerable in our community.
Elected representatives from both sides of the aisle weighed in. Assemblymember Rudy Salas called the situation egregious. He said, quote, "Last week we held an oversight hearing in the Capitol to make sure action is being taken on these serious issues. I will continue to work hard for our seniors and hold the governor and the Department of Public Health accountable." Assemblymember Vince Fong said he coordinated meetings to forge a county-state partnership to ensure that Kern County officials have the authority and ability to keep our residents safe. And State Senator Shannon Grove said she reached out to the Newsom administration requesting immediate action and accountability, and she's been monitoring and receiving daily updates from the state public health agency. Meantime, we reached out to the facilities named in this report, but they did not have an immediate comment. This as the California Department of Public Health confirms that agency is working on a statement. In Bakersfield, Eitan Wallace, 17 News.